Welcome to my channel. In this video today, we will be exploring the essential instrument used in respiratory physiology practical classes. These tools play a crucial role in understanding and analyzing respiratory systems, allowing students to gain hands-on experience in various experiments and measurements. It is an excellent way to get ready for the practical respiratory physiology spot exams. Let's dive into the list of instruments and their function to better comprehend their significance in studying respiratory physiology. Subscribe to our channel and hit the notification bell so you will never miss an update. If you would like to jump to specific part of the video, the timestamp is provided for you below in the description box. On the list is Kymograph. It's an essential instrument that is normally used in respiratory physiology as an accessory instrument to record charts from spirometer in wave form. It's actually an old instrument that has been replaced by Powerlab, but it was used to record in wave form responses of experimental tissue organ to stimulation for experiments like nerve and muscles, simple muscle twitch, wave summation, genesis of tetanus, non-low, and the rest of them, properties of cardiac muscles. But in respiratory physiology is used as an accessory instrument to record charts from spirometer in wave form. This is Powerlab hardware and respiratory accessories. Is a very versatile instrument, modern instrument that replaces Kymograph, and it can be used to carry out different experiments in physiology and various fields in medical line. These are the respiratory kits for Powerlabs. This is the Powerlab spirometer or pneumotachometer, and this is student spirometer. The student spirometer measures static lung volumes and capacities. It is normally filled with 9 liters of water and calibrated with 3-liter syringe. For the Powerlab spirometer, it measures dynamic lung volumes and airflow. This one is actually a two-way respiratory socket, which means inhalation and exhalation can go through these flow heads. This one is a one-way respiratory socket, which only exhalation can go through these flow heads. So this is the Powerlab with spirometry accessories attached to it. While this is the traditional volume spirometer, and this one is the Kymograph attached to it, which record in wave form the responses coming from this subject inhaling and exhaling through this device. Is normally filled with 9 liters of water also. Results obtained from spirometers are called spirogram, while factors affecting lung volumes and capacities include age, sex, exercise, even race. So these are accessory instrument that is normally attached to the spirometer, especially the student spirometer or the traditional volume spirometer. This is soda lime canister which absorb carbon dioxide expired during respiratory recordings, so to prevent suffocating the subject with carbon dioxide. The mouthpiece connects the subject to the respiratory circuits of the machine. We have disposable mouthpiece and reusable mouthpiece. These ones are the reusable mouthpiece. This one is for Powerlab, while this one is for the student spirometer. Next on the list is the nose clip. This is normally attached to the subject nostril to prevent air from coming through the nose to ensure subject breathes through the mouth only. Next is the dry gas meter. It is used to measure volume of expired gas collected from Douglas bag during respiratory function test. So these are the accessory instrument that is normally attached to the Douglas bag and Rudolph one-way non-rebreathing valve. You can see it here. It is attached to the Douglas bag at this point, and the mouthpiece is here, while this place is left open to the atmosphere. The door glass bag functions for collection of expired gas. There are precautions that need to be taken when using the door glass bag. You check the bag for tubes and valve for any leakage and ensure you empty the bag before collection. Sterilize breathing tubes, mouthpiece, and valve as per laboratory procedures, and make sure you close the door glass bag before vacuum pump is off to ensure ambient air doesn't re-enter the bag. So those are some of the precautions that need to be taken into consideration. The non-rebreathing valve is a special instrument. It is incorporated with unidirectional silicone rubber spiral type diaphragm that allows for separation of expired air, either for collection into door glass bag or for use with pneumotachometer. It consists of three ports or three parts: a mouth port, which connect the subject to the respiratory circuit, the inhalation and the exhalation port for installation in the breathing circuit. Valve is the exhalation port, which is normally attached to the door glass bag, while this is the mouth port where the mouthpiece is attached. The arrow here indicates the direction of flow of air through the valve, while this is the inhalation port. Next on the list is Vitalograph. Vitalograph is an essential instrument used clinically to measure dynamic lung volumes and air flows. It can measure parameters like FEV1, FVC, and FEV1 ratio, peak expiratory flow, post expiratory at 25 to 75%. And the results obtained from Vitalograph is called Vitalogram. The result obtained can be used to differentiate between different respiratory defects like obstructive respiratory defects and restrictive respiratory defects or combined respiratory defects. This accessory instrument normally attached to the Vitalograph. This is the bacterial filter that is help to protect the subject and the machine from being contaminated with pathogens. This is a disposable mouthpiece. It has a rubber diaphragm inside, a one-way valve inside. It can be used in place of, in absence of bacterial filter, it can be used, and it's disposable. Next on the list is pocket peak flow meter. It's used to measure the peak expiratory flow rates, the maximum flow rate in a single forced expiration, mostly used in asthma patients to monitor disease progression or the severity of the disease of air obstruction, or it can be used to monitor patient response to treatment with nebulizers. Precaution when using this instrument: the needle must always be reset to 0 before use. The subject must maintain a straight posture, whether standing or sitting. The flow meter should be held in the vertical plane. It should be placed and held in the mouth firmly and fully sealed with the lips to prevent air leakage. Unit of measurement is in liter per minute. Normal range for male is about 510 to 560 liters per minute, positive or negative 100. For female, 400 to 480 liters per minute, positive or negative 80. Thank you for watching. If you like this video, please hit the subscribe button so that you will be notified on the next video, and see you next time. Thank you.